What is an aneurysm? We hear that word a lot.
Yeah, an aneurysm is a dilatation, abnormal dilatation of the wall of any artery. In this case, we're talking about the aorta, which is the major vessel of the body, and from there, it's, you know, it gets branched to all the other arteries, big ones, small ones, and so forth. But an aneurysm is just a dilatation.
And what are the complications behind aneurysms? I know some of them can be very severe.
Well, Olga, really the problem, specifically talking about the aortic aneurysms, is that when you get to a certain point, they can either rupture or dissect. And when we mean rupture, dissection, it's mainly that way of rupture of the aorta. And indeed, it can rupture that and it cause the demise of the patient right away. But that's exactly what we would like to prevent to happen. And so that's the problem with the aneurysm, and that can happen anywhere in the body where an aneurysm is located.
And speaking of anywhere in the body, we have a 3D image, and I believe, Dr., let's have you walk over to that 3D image wall so you can show our viewers what an aortic aneurysm is. And since we're talking about a certain area, I believe, Doctor, this is an abdominal aneurysm?
That's correct. So here we have just the aorta coming out from the heart, but the heart is not in the picture. It goes all the way down. This little portion is what we call the ascending. Then it gives the branches to the brain and the arms, and then we don't see it here well, but we might see it later. It goes into the back and creates an arch, and then it goes down into the thoracic and then goes into the abdominal. There's a muscle here called the diaphragm that divides that. Saccular is just like you see it here. It's like when we were kids, we used to see a hose and it breaks and the black part comes out bulging. That's just what a saccular aneurysm is.
And when you see that saccular aneurysm, Doctor, what is happening in it? I see it obviously bulging out. What's making it bulge out and what's inside of it, if you can tell us?
Well, what makes it bulge is weakening of the wall. The wall just get weakened for whatever reason, and then it starts to dilate. It just keep dilating, and inside can form blood clots and things like that. But at the end, it's really this weakening what is the problem that we're having, and the risk for this to rupture.